Hello, in this video I'm going to be talking about the management of nausea and vomiting related to chemotherapy. What causes nausea and vomiting? What can you do to control it, and how should you work with your medical team? Before I go on, I'd love to invite you to subscribe to our channel. We're always putting out new content, often in response to questions and comments that you have, so there's always something new to watch. Chemotherapy-induced nausea and vomiting is one of the most serious and feared side effects of chemotherapy. None of us likes to be sick to our stomach. None of us likes to throw up, goodness knows. Although you may have the experience where you feel a little better after you throw up, it's still pretty nasty. Chemotherapy is a foreign agent in your body, and your body doesn't like to see that. Your body wants to get rid of these things, even when they're given for therapeutic reasons. Even when they're given to improve your outcome, your body wants to reject it. There's an area of at the base of our brain called the area postrema, and that part of the brain is exquisitely sensitive to foreign substances, and it wants to trigger the vomiting reflex. The GI tract, our gastrointestinal tract, also has receptors that are triggered by chemotherapy. Before I go on, I do just want to let you know that we know this is a serious side effect in medical oncology. Medicine knows this is serious, and we wish this weren't the case. So we've worked very hard to develop ways to counteract it. We also know, as you're listening, you're probably wondering, if this is so bad for me, why am I getting it? Well, as bad as it is for your body, and as much as your body wants to reject it, the cancer cells want to get rid of it even more, because these drugs are actually more effective and more harmful to cancer than they are to you. This is not in any way to trivialize what it feels like to get chemotherapy. So I just wanted to get that out there. So these parts of our body are naturally wired to get rid of foreign substances, even if getting them out of the GI tract isn't the best way to do that. It's our liver that metabolizes these, which of course is part of the GI tract, but is much more sophisticated. Diagnosed with breast cancer? Meet Yerbba, your guide to personalized treatment options. Each option is specifically tailored to the unique characteristics of your tumor. Sign up today at yerbba.com to take control of your breast cancer journey. Chemotherapy, nausea, and vomiting there are two types. There's immediate and there's delayed, or acute and delayed. The acute nausea and vomiting happens the day of treatment or the next day. The delayed, which we really don't always hear about from you, is a full day to 2 to 3 to 4 after chemotherapy. And I'm really happy to say we have ways to control that and really cut down on the delayed nausea and vomiting, but a lot of oncologists don't know you're having it. By the time you come in to see your doctor for the next cycle of chemotherapy, a lot of patients have forgotten it. So it's really important, if you're having delayed nausea and vomiting, to let your doctor, your medical team, the nurses know that you're having it, so they can make it better the next cycle. Even more important is it to prevent it in the first place. So it's really important with many chemotherapies to know, are they not likely to cause nausea? Are they moderately likely to cause it? Or are they very likely? And we are doing a not great job at treating the people getting the drugs that are very likely to cause nausea and delayed nausea, in part because a lot of oncologists don't know this is a problem for their patients. So I'm going to get off on my soapbox and move to some lifestyle ways you can manage nausea and vomiting, and then some of the medications you might receive or be prescribed or offered to help prevent it. So different ways of dealing with nausea and vomiting are to eat small, frequent meals, to stay hydrated. It's really interesting that even a bag of IV fluids can help people who are very nauseated no longer be nauseated. But you can do that on your own. You can make sure you drink plenty of fluids. We're talking, a liter, 2 liters a day. So you want to make sure you have a lot of fluid. It doesn't need to be just straight water. In fact, one of the things that can be helpful is to have flavored water or soda, like ginger ale. I'm in the Michigan area, and Verner's is our local made ginger ale. This is something a lot of patients here in Michigan will take to drink, but you can have sodas, you can have lemonade, fruit juices, or you can just even add a little citrus to your regular tap water. So those are a couple ways. Small, frequent meals. Avoid strong smells and flavors. If something triggers you, like the smell of blank makes me feel sick to my stomach, it should go without saying, you should avoid this. Don't worry, you'll enjoy it again in the future. In fact, to be honest, I recommend avoiding your favorite foods right around chemotherapy because you may develop an aversion to them. I'm going to share when I was little and I was sick, I wanted corn soup, and I got so sick, not related to the corn soup, I never want to see corn soup again. So if you'd like to develop an aversion to something, have it around the time you get chemotherapy, but otherwise save your favorite foods for when you feel great, or you could get conditioned to be sickened by some of your favorite things. So small, frequent meals, avoiding strong smells and flavors that turn your stomach, staying hydrated. And the other thing I can recommend, in addition to acupuncture, and you might want to check out our video on acupuncture, is ginger. And you might see ginger lozenges at the checkout counter. You can get candied ginger, you can get ginger gum, you can get ginger tea, which is quite spicy. You don't have to have the spicy feeling to get the benefit, but ginger appears to be quite effective in controlling nausea and vomiting. The other thing some people find helpful is aromatherapy with citrus, sometimes lavender, and ginger. These are all things that you can try. You can get a little essential oil and put it in a dish. Some people even put these oils on their wrists, and that can help. There are medications that you will be prescribed even before your first chemotherapy to prevent nausea and vomiting. As I mentioned, prevention is key because once people have experienced nausea and vomiting, their bodies get to the point where they expect it. So for the second cycle, your body's sort of programmed or conditioned to get sick again. So prevention is the key, not rescue medications. So you can tell your medical team, if this is highly likely to cause nausea and vomiting, I want all 4 medications. There are 4 medications that are used in the very emetogenic or nausea-producing chemotherapy. For people getting moderate or low likelihood of causing nausea, there are 3 medications that we give. And people who are unlikely to get nausea and vomiting, we just use 1 or 2. The medications everybody should get includes dexamethasone, which is a steroid, which has its own problems. I don't want to be shielding you from that. It can make it hard for you to sleep. It can make you irritable. It can make you really energetic and almost hyper. And it can stimulate your appetite, which if you're feeling nauseated may not be great. Over time, we don't like to give chronic steroids, so we only give it for a couple days around chemotherapy, the day of chemotherapy, and then 2 days after that. There are medications called 5-HT3 receptor antagonists. These are receptors that trigger nausea and vomiting, so by giving an antagonist, we can block them, those receptors, from stimulating nausea and vomiting. The NK1RAs are also highly effective in preventing nausea and vomiting. And for people very likely to get nausea, we also recommend the use of olanzapine, which is a very old, very inexpensive medication originally used for people with psychosis, but its small doses are highly effective at decreasing nausea and vomiting. And for 4 cycles of chemotherapy, it costs about $1 US. So really expensive, very accessible, old drug. A lot of oncologists haven't used it, but it's been around forever and it's been part of the guidelines for many years now. So if you're getting a highly emetogenic regimen, a regimen that's very likely to make you get nausea and vomiting, you can expect to see, or you can ask about olanzapine, and we'll put the spelling of that here. There are other things that can really help, like making sure you're managing your fatigue. And if you're very anxious, let your medical team know this because they might be able to give you something to help. cut down on the anxiety, and making sure that you're maintaining your routine as much as possible, even when you're having nausea, or even light, mild nausea, which I call stomach awareness. Most of us are not aware of our stomach during the day, but if you become aware of your stomach, go ahead and have a glass of ginger ale, or try some ginger, or take the breakthrough medication that your doctor or your team gave you. I've covered a lot. I hope it's been helpful. If you've had something to help with nausea and vomiting that we didn't mention, please go ahead and put it in the comments below. You can ask any questions. We try to get back to you as soon as possible. Although we can't give you specific advice to your case because we're not part of your treatment team, we can give you general information to help manage this important and really troublesome side effect. As always, thank you for watching, and we'll see you next time.